Hello, and welcome to our conversation about what is the difference between delirium and dementia. We want caregivers to be aware of the signs and symptoms of delirium as well as dementia. Caregivers will learn so much from Dr. Vermani and his knowledge on this topic. My name is Laura Spradley, and I'm the Outreach Coordinator for the Arkansas Geriatric Education Collaborative at UAMS in the Department of Geriatrics at UAMS. Today, I'm happy to be here having a conversation with Dr. Tuhin Vermani, MD, PhD. Dr. Vermani is an associate professor in the Department of Neurology, and he is also the director of the Huntington's Disease Society of America's Center of Excellence at UAMS. He completed his neurology residency at Washington University in St. Louis and a movements disorder clinical research fellowship at Columbia University in New York. His research interests include gait disorders in neurodegenerative disease, specifically the phenomena of freezing of gait in Parkinson's disease. Thank you for being with me this morning, Dr.
Thank you for having me.
You're welcome. Dr. Vermani, let's tell our audience, what exactly is delirium?
So that is actually probably the toughest question. Delirium is kind of a catch-all that we use sometimes for different causes of changes in mental status, and what that means is that people sometimes can have sudden changes in the way they're able to think. They may seem confused, they may not respond as well, they may be groggy, they may look sedated, and so that is kind of the all-encompassing term that we use for those different changes in mental status.
And I heard you use the word sudden. It comes on very quickly, usually?
Yeah, usually it's on the order of hours to days, in comparison to some other diseases that are more slowly progressive over time.
Great. Okay, so if they see a sudden change. Dr. Vermani, what symptoms should a caregiver be looking for if they are suspecting delirium?
There can be many changes, but the main thing to be looking for is there a change in personality that's more rapid or on the order of hours to days as opposed to something more long-standing. But after that, there can be any number of symptoms. People may hallucinate, people may be more aggressive or agitated, people may seem more confused, so things like don't know where they are, don't know who their spouse is. But also some people may slow down, they may not be responding as quickly as they may have in the past. They may seem sedated or wanting to sleep all the time. So there's a wide range of symptoms that can manifest as what we term delirium.
I heard you say maybe quicker, it comes on quicker.
Correct.
Okay.
Right, so in relation to someone who has, say, Alzheimer's dementia, where you can look back and there's this been slow course of decline over time in their ability to think, over years, a change in their ability to perform their activities of daily living. This would be more abrupt within, again, hours to days usually, but sometimes even weeks, just depending on what the underlying problem is.
Is there one single reason, or are there multiple reasons for delirium?
There are many different causes of delirium, and that's why it's important to go to your medical care provider if you're worried about a change in someone's personality over that short period of time. Something as simple as a urinary tract infection can cause someone with, say, Alzheimer's dementia or Parkinson's disease to be confused and not be their normal self. And it's important to know that so that you treat the urinary infection early rather than let it get worse. Medication changes can often lead to delirium. Different new medical problems can cause people to have delirium, especially in an older adult population, in a population that has already some form of brain disease, whether it be, again, a degenerative disorder or a prior stroke or multiple sclerosis or any of those other brain disorders.
So let's clarify for the audience what the difference is between hyperactive delirium and hypoactive delirium.
Right, so hyperactive means excess, so people will maybe sometimes get agitated or even aggressive, irritable, act out more, hallucinate. whereas hypoactive means lessened, so people will be more sedated or sleepy, groggy, maybe not responding or interacting as they might normally do.
Okay. And again, does this come on more suddenly?
Correct. Usually, again, hours to days, as opposed to people with some of the neurodegenerative disorders, which can take years to kind of manifest slowly.
Okay. Can someone have both dementia and delirium? And would there be a difference in the symptoms? How would you?
Yeah, so again, it's that time course, but dementia actually is one of the most common risk factors for developing delirium. So because people with dementia or other neurodegenerative disorders like Parkinson's already have some changes in the brain that are impacting the way they're able to think or their body's able to function, when they have, say, a change in a medication or an infection or some other medical problem, thinking processes are affected by that other problem is by manifestation of delirium or the confusion or the other symptoms we talked about.
Since we're talking to caregivers, when should they seek medical care if they're suspecting delirium?
So again, kind of the topic that along the same lines as what we've been talking about. If you think that there's a relatively sudden change in your loved one's personality or someone you're taking care of, their personality has changed and they're not their normal self, and we're not talking over years, we're talking over, again, days, then definitely you want to talk to your doctor, and especially if they're agitated or aggressive and acting out, maybe even more suddenly, like going to an urgent care center or emergency room even, because sometimes the causes of this is some other medical problem, and so you want to figure out what that cause is so that you can treat the cause and get them back to their normal selves.
Sooner rather than later.
Sooner rather than later.
Good. Okay, so is there a single reason, or are there multiple reasons that delirium comes on? Is it just...
Yeah, so there are many different reasons. We touched on some of those. So sometimes people can react to a new medication in different ways and cause a delirium. Some people, if their blood sugar gets too low or too high and is running that way, if they have an infection, especially in the older adult population, something as simple as a urinary tract infection can make someone look like they are now having dementia, but it's just that rapid onset as opposed to a long progressive course. Looking for those changes in medication or other can help.
We always tell caregivers to document when they start a new medicine for their loved one, to any changes. So would that be a good
Right. And so when we're trying to think about delirium, it's history. So learning from the caregivers, learning from other collateral sources, what changes may have occurred, looking at the chart, looking through all the different parts of a person's medical history can help us try and figure out what the cause of that change was.
So are there any risk factors associated with if someone does have delirium, things to...
Right, so the risk factors for delirium, again, underlying neurodegenerative disease such as Parkinson's or Alzheimer's disease is a risk factor for developing delirium when there's a medical problem. Age seems to be a risk factor as well to a degree. And then there are just some people who react differently to different underlying conditions, and so it's hard to say.
Very good. Thank you. Great information. And I guess the main thing is to just be aware and document changes.
Right.
So that they can present those to you as the medical team.
Definitely.
Well, thank you, Doctor, again.
Thank you.
This information has been brought to you by a grant from the Health Resources and Services Administration. Check out more clips on dementia and caregiving at agec.uams.edu.